Well, hello, everyone. My name is Bill Keck, Chair of the Academic Health Department Learning Community and the Council on Linkages between Academia and Public Health Practice. I'd like to welcome everyone to today's Academic Health Department Learning Community webinar entitled Innovating a Teaching Health Department. Before we begin, however, I'd like to ask Kathleen Amos to go over some of the housekeeping items associated with the GoToWebinar software we're using today. And just to let you know that Russ Rubin of the Public Health Foundation staff is operating the software in the background. So Kathleen, if you would.
Absolutely, thank you, Bill. And thank you all for joining us for the webinar today. As we get started, as Bill mentioned, we always like to just go over a few housekeeping items. So on the slide here, you can see an image of the attendee control panel, which you should also have on the right side of your computer screen. And this control panel is your hub for interacting with the webinar. So first, in that control panel, you should see an audio section. You have two options for accessing audio for this webinar, either through your computer speakers or over the phone. If you're using your computer speakers and a mic, please choose the computer audio option. If you are using your phone, please choose the phone call option and enter your audio PIN, which can also be found in that audio panel. Please make sure to select the audio option you're using, and if you choose to listen over the phone, just also please make sure to mute your computer speakers, because that will help reduce any echoing. Regardless of which option you choose, all participants in the webinar today are currently muted. The slides, as well as a few supplemental materials for today's presentation, are available for download in the handout section of the control panel, if you would like to have copies of those. Links included in those items are not live, links included in the slides are not live during the webinar presentation, but they are in the handouts. So if you do download any of those items, you can use those links to take you to the additional resources. Throughout the webinar, please submit your questions or comments via the questions box in the control panel. Please feel free to send in your questions for the presenters at any time, and we will address as many as possible during the Q&A discussion portion of the webinar towards the end of the webinar. When we get to that part of the webinar, please also feel free to raise your hand, and we can unmute your line if you would like to ask a question verbally. If you have difficulty with any of the technology for the webinar, as Bill mentioned, Russ Rubin is here and myself. Please feel free to use the questions box to send a message and we can help you troubleshoot that. And finally, we are recording the webinar today, and the archive will be available following the webinar to you and to others who are unable to join us. That's all from me. Thanks a lot, Bill.
All right, thank you, Kathleen. Well, some of you on the call are new to us, so I'd like to take just a moment to fill you in a bit about our learning community background. We're a product of the Council on Linkages between Academia and Public Health Practice, and are staffed by folks from the Public Health Foundation. The Council, as you can see, is made up of 23 national public health organizations, including CDC and HRSA. Our funding, for which we are very thankful, comes principally from the Centers for Disease Control and Prevention. And we have three major goals that are listed on the slide for you, all of them related to linking academia and practice. The next slide, please. We're often asked just what an academic health department actually is. A wide range of agencies, institutions, and arrangements are involved in these partnerships, making a tight definition difficult and perhaps unnecessary. Well, this slide contains some of the phrases we use to describe these arrangements, and we present them here in hopes they may be helpful to understanding and perhaps useful to you. I won't go through each of them, but encourage you to download the slides if you wish to have more time with them. The next slide. The Council on Linkages is perhaps best known for its work to develop core competencies for public health workers, but the learning community is also an important program for us. That learning community is now in its 9th year, I believe, and our activities are noted in the bullet points on this slide. If you're not a member and wish to join us, just drop an email to Kathleen Amos at kamos@phf.org. The next slide. The learning community now has grown to more than 1,100 individuals since we began in 2011, and over 60 academic health department partnerships have connected with us. Association with us gives you access to the activities and tools listed on this slide. And the next slide, please. This shows you the distribution of our members across the U.S., they're the yellow dots, as well as the location of academic health department partnerships we're aware of, and they're the blue dots. There are obviously many more than those we've shown, but the one present on the slide indicate those agencies that have been active with us. And now the next slide. Let's go on to our speakers for today. With us for the webinar is Amanda Mail, who's a registered nurse with a master's degree in public health. Amanda's worked in public health for 13 years and currently oversees the operations of the Boone County Health Department in Belvidere, Illinois, as their public health administrator. And over the past 2.5 years, Amanda's developed her department as a teaching health department, mentoring students from different disciplines at the undergraduate and graduate levels. Also with us is Emily Morales-Reyes, a recent graduate from the University of Illinois at Chicago, receiving a bachelor's degree in public health. And today, Emily is here from the Boone County Health Department, where she began as an intern and was later offered a contracted position as project coordinator. So Amanda and Emily, the floor is yours. Please go ahead.
Great. Good afternoon, everyone. This is Amanda Mail calling in from the Boone County Health Department. Thank you so much, Bill, Kathleen, Russ, and the Public Health Foundation for this amazing opportunity. We are so pleased to represent our local community and the state of Illinois today on the Academic Health Department Learning Collaborative. I've been participating in these calls now for a couple of years, and really many of the ideas that we have pulled together to innovate our teaching health department here in Boone County have come from a lot of the wonderful ideas across the country that are presented through this collaborative. So a lot of rich and wonderful things have happened locally because of this network of folks. So if we can lend a hand to some of you on the call today, it would absolutely be our pleasure. All right, so 3 primary learning objectives for today. We hope that you can walk away from today's call with maybe some ideas on how to identify appropriate projects for interns, including the development of learning objectives, developing an intern's learning plan using a public health 3.0 process and framework, and then also some tips and tricks on how to leverage buy-in of our Boone County Teaching Health Department, and then possibly for wider communities, not only from staff, but from your stakeholders. We're going to cover a variety of different topics here with my slides pretty quickly here.
Amanda, excuse me, I'll interrupt you just for a moment. Kathleen and Russ, there's some background noise.
Thanks, Bill. We're working on to clear up the background noise. Just pause for 1 minute, and we'll Amanda, just wait for my instruction to continue. Thanks.
No problem.
Thank you. Okay, sorry for the interruption. Amanda, please go ahead.
Okay, great. Thank you so much, Russ. So we're going to cover the topics listed here on the presentation at a glance slide. I'm going to run through my stuff here pretty quickly because I'd like to give the floor as much as possible to a few really tangible and concrete examples from the perspective of an intern that's been through our project and our program here. All right, so just to lay a little bit of groundwork and context to our health department and our community, for those of you that are located again across the country, we are a small rural health department serving a small rural community and are faced with many of the same challenges that I'm sure that all of you are faced with as well. We deal with obesity rates here that are higher than the state average. We deal with a percentage of our families who are food insecure and relying on SNAP benefits. We deal with unemployment. We are dealing with an opioid crisis that is known to many of you across the country. We are dealing with a growing population of Hispanic Latino immigrants, some of whom are undocumented. We have a huge lack of access to healthcare resources and mental health services, and just a lack of access to transportation and language barriers too that our rural community faces that make our day-to-day jobs just a little bit trickier. And so how to kind of balance all of that while building and growing and changing a local health department is an ongoing challenge that we're learning from every day. So here at the Boone County Health Department, we have 14 full-time and part-time employees, and we make ends meet, if it were, every fiscal year through local taxes, permit, license, and clinic fees, and then also program grants, both local and state program grants, and then several federal pass-through grants. About 45% of our operating budget comes from grants, and about a quarter comes from local taxes. So for those of you that are not as familiar as we are with the great state of Illinois, we are the 5th most populated state in the nation. A lot of our population is concentrated in large urban centers, and then really the rest of the state is very rural, including our community. We are a decentralized public health system divided up into 7 Illinois Department of Public Health regions. We are county health department employees, some city health departments. We do have some local health departments that serve more than one county, but we're definitely operating with local directives as well as Illinois Department of Public Health directives. We have several regional and statewide associations where we collaborate and share together on best practices across the different regions and across the state. And then also an important piece to note too in the context of this presentation is that our local health department certification process is tied to our 4 core programs of water, sewer, foods, communicable disease, and then also what we call in Illinois our Illinois Plan for Local Area Needs, or our CHA-CHIP, our Community Health Assessment and Community Health Improvement Plan process. So just a little bit of a timeline. I've been in my position now for 3 years, and if we rewind the clock about 3 years, we were faced with not only a local budget deficit, but we also had the pleasure here in the state of Illinois of making national news for having a budget stalemate in Springfield, Illinois for multiple fiscal years. And those challenges coupled with some of the challenges that we faced with our billing process here locally. Many of our traditionally Medicaid clientele had been transitioned out of Illinois Medicaid and into managed care organizations, making the billing for many of our direct services here locally a challenge. We were not getting the reimbursement rates that we had once been getting. And we had also begun the process of pursuing our Public Health Accreditation Board process. So we started using interns really, to be quite honest, out of absolute need for an extra set of hands, for some new and fresh ideas, to help us transition from direct services to more of a population health or a public health 3.0 model, but then also to help us complete many of the projects that were required for the FAB accreditation process. So 2017 and 2018 were filled with ticking the tick marks of the FAB accreditation readiness checklist off one by one, slowly but surely, 2 steps forward, 8 steps back, 4 steps forward, 10 steps back, and making a little bit of progress along the way. We completed our first ever I-Plan using the mobilizing action through planning and partnerships, which was really exciting. We completed our first ever departmental strategic plan and workforce development plan. We did several strategic planning sessions both within our local county government and also with our wider community, identifying a need for data, for local data and resource sharing, stronger community relationships, reach and outreach, educating the wider community and the up and coming workforce about what it means to do local public health and this transition that we were making from being a WIC clinic, from being an immunization center, to being a more population health-based public health 3.0 health department. So for those of you on the call that are wanting just a real brief refresher on Public Health 3.0, really a call to action from the CDC in the last handful of years, highlighting cross-sector collaboration and the role of the local health department shifting from direct service model to that chief health strategist or kind of mover, shaker, setting the table and bringing the partners together role, which we've been undergoing, and that's been lining up really nicely with our FAB accreditation process. I would say that every single component of this journey would not have been possible over the last 3 years if it hadn't been for our interns. If we take a look at the 10 essential services of public health, or the 12 FAB domains, domain 8, essential service 8, is workforce development. And it's really not just training about our future workforce, but it's training the future workforce in general to understand public health and the public health system. So if we have nursing students that are coming through our program here, they may not choose to go into the field of public health, but man, oh man, do we need hospital nurses and clinic nurses and nurses at doctor's office to understand the role of a local public health department in the community and what it means to be part of that local public health system. So what have we learned here that makes an internship successful? It's absolutely essential that we have a plan. So all of our interns go through a rigorous application process. They are interviewed. They are given a clear job description. They are assigned a mentor or a supervisor who does regular one-on-one meetings and performance reviews. They are given a work schedule, a designated workspace, and specific projects that are lined up with those 12 FAB domains, or those 10 essential public health services, that they can start and finish within the time that they're here. They are treated as members of our team. They are held to the same standard that we hold our part-time and full-time staff as far as professionalism, career development, skill building. And then another thing that we have learned along the way is that it's extremely important with all of our regional academic institutions to have a memorandum of understanding clearly outlining what the health department will provide to the student and to our academic partner, and then what we expect in return. So we have gained so much knowledge and so much power and so much creativity from our interns. I know in talking to my colleagues across the state and across the nation, you oftentimes hear that gaining staff buy-in for bringing interns in can be a challenge, and we definitely faced some of those challenges, but we have really shifted our culture here where it is just part of what we do to have students as opposed to the exception to the rule. And so it would feel odd, I think, here if you asked my staff if we didn't have an intern in the building, it would feel like something wasn't quite right. And that has been really a 3-year process to get to that point. We have had interns attend board meetings, attend staff meetings, come up with new ideas, thinking about something completely differently from the way that we'd been thinking about it for the last, several years, and given us a new direction to head with a lot of our policies and a lot of our development here as an organization. Here is some feedback that we have gotten from exit interviews with students that have gone through our Boone County Teaching Health Department. They're listed here on the screen. I'm going to let Emily spend quite a bit more time talking about her perspective as an intern and kind of some of the professional skills that she has developed and some of the perks and benefits of being part of our Boone County Teaching Health Department. Successes and challenges are happening every day with our program. I would say that our teaching health department is not and will never be static. Just when we think we might be getting a handle on kind of a way to create a form or a way to provide some guidance for an intern, we come up with a new idea or we make a mistake and learn from it, right? So gaining the buy-in from staff has been huge. It's been a success with some challenges along the way. Marketing our internship, we're currently working really hard to outreach to what we would call non-traditional health department interns. We would love to bring a marketing intern in to assist us with some social media campaigns and some marketing activities. We would love to bring a business student in to help us with some of our long-term financial planning that we're doing. A huge success that we've had that was initially a challenge was bringing in nursing students for half-day clinical rotations. We were finding that the number of staff that we had available and the volume of visits that we would have in our clinic on any given day was sometimes not enough to support a stimulating environment for those student nurses. So it was actually our staff here that came up with the idea of creating a PowerPoint scavenger hunt to walk students, nursing students, through the 10 essential public health services and give them questions to walk around and interview staff to learn more. The other thing that we have learned is that nursing students absolutely love restaurant inspections and they love well and septic inspections. So our environmental center team has really been up to the challenge of taking nursing students and even some MD students out on appointments in the field, allowing them to have that experience, because that's something that they won't see at any of their other clinical sites during nursing school. Another one of our most recent challenges that we have slowly but surely been extremely successful with is expanding the concept of the teaching health department to be more than an intern for the health department and to actually be an intern for a local interdisciplinary coalition or task force. Emily will talk a little bit more about that here in a minute. But these are the types of student opportunities that we have here at the Boone County Teaching Health Department. Half-day clinical rotations, as I mentioned, semester-long internships for credit and non-credit, and then contractual internships. We have now had the opportunity to do this twice, where we brought an intern back to continue to work on a project that they had previously begun, or to come on board and work on something different because their skill set was really the most appropriate for the job. So these internship assignments, in thinking about this sort of public health 3.0 framework, not only have we assigned interns here in our department to the interdepartmental projects, but we've also begun sharing interns with our community partners and gearing internship projects towards collaborative community initiatives as part of the local public health system. So the next two slides give just a few examples of some of the internship projects that we have been successful with. I'll just give a few examples here briefly. We had a policy student come on board with us, and she attended some local coalition meetings. She came to a couple of our Board of Health meetings. She went out with our environmental center staff, and she assisted us with developing a departmental nuisance policy. Our first ever workforce development plan was put together by a BA in public health student, and she had the task of putting together a survey monkey where we were able to assess staff capacity regarding those public health foundation competencies. And what a better way, I can't think of a better way to engage a student in understanding the framework of those PHF competencies than to have them actually work with the staff on figuring out, you know, where staff feel like their skill sets lie and where they might need some additional professional development. She also assisted in rewriting job descriptions for all of our 14 employees to line them up with those public health foundation competencies. And in the process of interviewing each one of those staff members, she learned a little bit more about what programs and services we have available and some of the transitions that we're making with our staff capacity. To transition to some of our more outward-looking or public health systems internship projects, we had a graduate student that led our MAP Forces of Change and our MAP Local Public Health Systems Assessment. Can't think of really a better or more succinct way to teach a graduate level MPH student about those 10 essential services than to put them up in front of all of our community partners and our boards and have them interact with our local leadership on really what the public health system in Boone County has to offer, where some of those gaps may lie, and what are some of those forces of change that we foresee over the next 3, 5, 10, 15 years. We did have an intern come on board with us that participated with our Boone County Hunger Coalition. She job shadowed not only here at the health department, but every single one of the stakeholders that sits on that coalition. She led us through a mission and visioning process, helped us to develop our 4 main goals and objectives, and wrote our Boone County Food Security Plan, which we are still using today. I am going to turn it over just very briefly here at this moment. I had the opportunity to bring an extra guest on with me today. and that is Kenya Aguayo Miramontes. And Kenya was a student intern through our Boone County Teaching Health Department, and she is now a full-time environmental health practitioner, sanitarian, and she just was going to share a few tangible examples of her project and how that helped her to develop her professional career set.
Hi, my name is Kenya Aguayo. So I was their intern last August through December. I was their intern and I did emergency preparedness and environmental health. For emergency preparedness, I did a lot of planning. I updated some binders and some information throughout the county. I got to be part of some food clinics. I created a lead banner to promote lead. I did some food inspections. And now I'm a full-time employee and I do well and septic, potable water, food inspections, West Nile virus, and a lot more things that are in part with environmental health. And I would say when I was an intern, I got to learn a lot about different things and how the department is ran.
Great. Thank you, Kenya, so much. All right, I'm going to turn the floor over to Emily Morales-Reyes. I'm so pleased to have her as my co-presenter and have her walk you all through her experience here with the Boone County Teaching Health Department. Emily?
Thanks, Amanda. Hi, everyone. This is Emily speaking. Thank you so much for taking the time to listen in, and thank you to the Public Health Foundation for allowing me to share my experience as an intern at the Boone County Health Department. So I was a summer intern in 2018. I found out about this internship through my TA while I was a junior at University of Illinois at Chicago. I was majoring in public health, and my TA had presented to the class about his project at the Boone County Health Department. He was involved with the FAB accreditation process here, and he spoke highly of Boone County and all of the staff members here. And so I was greatly interested, also because I grew up in Boone County and I really hadn't met anyone from Boone County while living in Chicago. And so he got me in contact with Amanda, and so I went through the application and interview process, and then Amanda was paired up as my mentor and supervisor. And so initially when I came to the Boone County Health Department, I was interested in policy work, health disparities, and community health. I was still trying to find sort of my bearing in public health. I sort of just loved it all, and I hadn't found a niche yet. And so I was involved in an array of different projects at the Boone County Health Department. Me and another intern, for instance, created a diversity workshop for staff. I helped staff with day-to-day projects and accompanied staff to food inspections at our county fair, but most of my time was focused in on the Boone County Healthy Work Initiative, which I'll tell you a little bit more in the next slide. So the Boone County Healthy Work Initiative was really started from the UIC Center for Healthy Work, and so they invited the Boone County Health Department to take a look at how work was impacting health in our community. And so the health department invited a member of our county board, the executive director from Growth Dimensions, which is a key organization in economic development in the county, and then a business representative from the Workforce Connection, which assists in connecting community members to employment, job training, and education. And so both these organizations really help lead the way in regional economic growth. And so together as a team, we took a look at how we could further explore the root causes of precarious work. And UIC was defining precarious work as low wage, high hazard, a lack of benefits, permanency, or opportunities for advancement. And so precarious work is a complex issue that impacts an increasing number of workers in all economic sectors, resulting in adverse worker, family, and community health outcomes. And so together as a team, we really formed these cross-sectoral partnerships, and with local leadership addressed the drivers of precarious work across the systems level. So during my internship, I spent some time taking a look at key priority areas in our employment and economic sectors. And so we took some of this information and we also aligned that with our MAP process, or the Mobilizing Action for Planning and Partnership. Because our initiative was focused on improving community health, these strategic plans aligned well together. And so I'd mentioned UIC's collaborative had these summer sessions, these 4-hour 6 summer sessions, and together as a team we attended these and learned more about precarious work and how this was an important contributing factor to health status. And then all of this really eventually led up to the strategic plans being developed. So my internship, a bulk of my time was spent creating these plans, learning about what strategic planning looks like. This wasn't something I'd run into during any of my courses at UIC, and so this was a great skill to develop. So responsibilities as an intern were different on a day-to-day basis. I attended, day-to-day activities with Amanda. For instance, she led the Behavioral Health Task Force Coalition, which was taking a look at how the county could address the opioid crisis. And so I attended those meetings with her, and that was a really interesting and fun experience to sit at this table with stakeholders across our county. When I first started as an intern here, there was a TB investigation going on, so I got to see sort of how they dealt with that and what that looked like for a rural health department. I produced that diversity workshop with another intern for staff members. Amanda had me lead conference calls and meetings, which being put in a leadership position like that was really, really great for me to sort of advance my skills and my communication skills. And then by the end of my internship, I had created some deliverables, that strategic plan that I'd mentioned, and then I presented to local leadership about the Boone County Healthy Work Initiative, what we had done and what we had planned to do for phase 2 and potentially phase 3. So these are just some of the lessons I learned as a student intern. As I had mentioned, the team, spent some time creating these cross-sectoral partnerships, and I got to see what that looks like and just how important that is, especially to a rural county like ours, where, as Amanda had mentioned, we're strapped for resources at times. I also got a better understanding of what was going on in my community. Growing up here, I thought I had a pretty good understanding of what the health needs were, but spending the summer here as an intern really helped me gain a deeper awareness of what was going on. And then among other things, improving my presentation skills, it increased my confidence socially and academically, and like I said, I got to understand the struggles of a rural health department. So then moving into sort of my second internship here at UIC, after I had left, Amanda and the team applied for grants being offered at UIC Center for Healthy Work. And so with that, they were able to have me come back and use some of the skills that I developed as an intern, and that was also used, to leverage and gain support and continue the initiative into phase 2. And while I was project coordinator, I got to present at a couple of really awesome and fun conferences, the National Association for County and City Health Officials, and then just last week, the local Illinois Public Health Association here. And so I got to spend some time talking to different public health professionals across the US and here in Illinois, and it was a great learning experience and a great networking experience along with that. So here's the timeline for phase 2, or really the timeline for my second internship. And so we spent a lot of the time, the first half of this initiative, gaining buy-in from our stakeholders and local leadership. And then during phase 2 of our initiative, we decided we would conduct focus groups to understand workplace dynamics. And so I spent some time conducting those and organizing those, advertising for those, and then ended with the analysis of the data that we collected, and then initiating the draft of a city council and county board resolution. And then, so as I said, some of my responsibilities as project coordinator, and I mentioned those during the last slide, but really just identifying and receiving the support for local government was a great teaching lesson for me, to see what those sort of conversations look like, and then conducting and helping organize those 5 focus groups helped me take a look at what community outreach is like. Those were a great opportunity for me to speak in front of employers and employees in the county. And then I ended my position as project coordinator with a few more deliverables, which was a phase 2 report that I wrote, presentations to our county board, and then the Boone County Healthy Work resolution. And so this resolution was really the highlight, I think, of my project coordinator position. We met with our Health and Human Services Committee on a month-to-month basis. And so in August, we met with them to give them sort of a final report of the data we collected and where our project, where phase 2 had ended, and asked for their support to bring this resolution to the full county board. And so they voted unanimously to do that. And then the following week, we went to the full county board and they passed that resolution with an 11-to-1 vote. And so some of the lessons I also learned as project coordinator, conflict resolution was an interesting one. Our project initially wasn't supported by some of local government, and so I got to see what that looks like and what that's like, and then receiving support from others. And then along with that, improving public speaking skills, going in front of your county board to speak was a scary experience for me, but Amanda sort of helped coach me through that and encouraged me and really gave me the confidence to do those things. Again, observing the struggles of local health departments, and not only just ours, but other health departments when I was speaking with others at the few conferences that I attended, and then taking a look at what leveraging local support looks like, enhancing my communication skills, and then facilitating those focus groups. So Amanda's gonna give you some recommendations and advice on the teaching health department.
Great, thanks, Emily. What a great recap on all the work that you've done for not only this department, but also for the community here. So just a couple of key highlights here on this slide. Considering students from all different disciplines, not just public health or nursing students at your academic health department or at your teaching health department. Considering these interdisciplinary projects has been a huge success for us, and we're already seeing really positive feedback from the community and positive change in the community. We have a whole section on our website that's reserved for student testimonials and information about our philosophy as a teaching health department and sort of guidance and expectations for prospective academic institutions that might want to learn about what we're all about, but also prospective students, and encouraging the ideas of projects of partners and students. Here at the health department, we are not going to always be the expert on every community project or every strategic planning process that needs to happen in the community. So if we can leverage interns to help us to listen to our community and what those needs might be, and put them out in the community assisting us, it's been an extremely rewarding process. And then I always try to think to myself, and I encourage my staff to do the same thing. Gosh, what do I wish I had learned in school, or what do I wish I had been exposed to as an intern that would have made the transition to the public health workforce or the workforce in general just a little smoother, a little easier, maybe less nerve-wracking, and then provide those opportunities for students. We are so in belief that students are part of our workforce here. They are treated like staff, and they are given those opportunities to grow and learn and to make a mistake and then pick themselves back up and learn from that experience. Giving them those real projects, setting real expectations and tangible goals, having regular check-ins. So because we have built this into our culture here, staff, as part of our onboarding process, understand exactly what it means to be a project mentor or an intern mentor, and that is built into their regular work days and their regular work weeks. So it is an expectation that if they are mentoring a student, that they are doing regular checkpoints and following up and providing that guidance. But we don't hold hands with our interns. We put them out there. We expect that they step forward and initiate and take their learning plan and then run with it. We loop them into day-to-day meetings. We loop them into the most recent communicable disease outbreak. We loop them into the fair or a large food event that's happening on the weekend. We want to make sure that they are pulled just like a regular staff member would be pulled from their day-to-day operations to experience the constant changing field of local, regional, state, or tribal public health that many of you on this call can relate to. And I cannot stress this enough. Remember that we are training, you are training tomorrow's workforce, not only the workforce of our local public health departments or our local public health system, but also the workforce in general. If we can train up and coming students, the next generations in our communities to think with a public health lens or think with a public health 3.0 frameworking in their marketing job, in their business job, in their accounting job, in their hospital job, then we're really doing a better service to our field of public health overall, nationwide, really.
Yeah, so I think just to add on to that, providing constructive feedback throughout the internship was really important for me. you know, I came in with, you know, my set of skills, and Amanda sort of helped me expand on those. And then my weak points were something that I had to really work on and focus on getting stronger at. And that's made, I think, as we mentioned in earlier slides, moving into the workforce that much easier and smoother as a process. And so, like some of the other things mentioned here, supporting your staff members as you're mentoring students. Some of the staff members were very comfortable coming to me and asking for help, and others I think were a little hesitant to. And so, yeah, I think it's just really important to sort of give them the tools to support students. And then, as Amanda had mentioned, you know, never stop innovating your concept and going back and reevaluating what's working. You know, when I ended my internship, I had an interview at the very end of it, and I think things like that, those sort of tools, really help you reevaluate what's working and what's not.
Great, thanks, Emily. There are a few resources that are also available, documents that the Public Health Foundation AHD Collaborative has uploaded to this webinar. One is a brainstorming tips and ideas sheets for how to come up with projects or activities that you all need done in your respective organizations, and then guiding you through processes of determining whether that may or may not be appropriate for a student intern. And that is something that we use here in management staff meetings. We use that here at employee annual reviews if we're trying to adjust workloads or figure out what projects might lie ahead, and then identifying what might be most appropriate for an intern. I also provided a copy of our exit interview process that is both a self-evaluation that the student completes no matter what academic institution they come from, and then also the mentor's evaluation of that student. So when we talk about the future of public health, it's not just about shifting numbers. It's about a new way of doing the work of public health. So we are very grateful for this opportunity to share our teaching health department experience with you. And I guess I would turn it back over to Kathleen or Bill, Public Health Foundation staff from here.
Very good. Amanda and Emily, our thanks to you for a very interesting presentation. I gather, Kathleen, that questions have been coming in. Do you want to share some of them with us, please?
You gather correctly, and we would love to. And just as a reminder, if you do have a question for any of our presenters, please do feel free to type that into the questions box, and we'll go try to address as many as we can in the next 15 minutes or so that we have left in the webinar. Amanda, Emily, thank you so much for a fantastic presentation. We do have a few questions to get us started related to specifics. A couple questions about how many hours did your interns commit over a semester, and do you feel like there's an optimal number of hours that you would like an intern to work with your organization?
That's a really great question. So for us and in our area, it really depends on whether the intern has sought us out for a 4-credit internship that requires a certain number of on-site hours to be eligible for their academic credit, or whether they have sought us out not for credit, but just for the experience. It really is going to boil down to what are the needs of your department, what projects have you potentially pre-identified that would be a good fit for an intern, what that intern's skill set is when you do that first interview, and then the number of hours that they're going to be able to commit for X period of time. So we require that interns are very clear with us that it's a, 4-month internship, they need 365 hours, or it's not for credit, and I'm working and I'm in school and I have children, and so I'm going to be able to dedicate X number of hours per week on these days, and then we develop a plan that is appropriate based on what they can give. So we have part-time interns here that may be here 1-2 days a week, and then we'll have full-time interns that are really putting in the equivalent of full-time hours with our department for that 3 to 4 month period of time during their academic semester.
Great. And do you partner with local universities for your internship program, or do you go kind of beyond, I guess, the immediate geographic area at all?
So that's a great question as well. We began our program really partnering with our our community college and our regional academic institutions that were within a reasonable distance of our site, because all of our interns up until about 6 weeks ago have been local enough to spend the majority of their time here in our office. We are trying something brand new. We'll see how it goes. We may take a few steps backwards, but so far it's going pretty well. We have our first remote-only intern, and she's a graduate student actually in Washington State, interested in emergency preparedness, and she's assisting us with our first ever community recovery plan for our FEP program, for our Public Health Emergency Preparedness program. And so we are flexible and willing to try something new like that, to enhance a student's learning experience, but also really to meet the needs of our department and our community as far as getting projects accomplished.
Wonderful. And do you have, do you have formal partnership agreements in place with those academic institutions where the interns are going to school so that they can, well, I know you just talked about a credit for their work, or is that something more arranged kind of on a one-off basis driven by an individual student?
We do have formal memorandums of understanding with a handful of universities and a community college here in our region. And then now with this academic institution in Washington State, if a student approaches us and it's a university or a school or an academic partner that we have not worked with yet, then we go ahead and reach out to that academic institution to initiate that partnership. So over the course of the last 3 years, we have actually expanded our network to include more academic partners. And I will just speak to this briefly, this has been a huge asset for us because one of our major gaps that we were faced with, we don't have any higher level institutions in our county. They're all out of county. And so we sometimes struggled to bring those stakeholders to the table for our MAP process or for a strategic planning session or to fulfill the requirements of domain 10, research. And with our teaching health department, we now have much stronger academic partnerships, and those folks come to our meetings and come to our table because we are providing this invaluable exchange of information with their students.
Wonderful. And when you started doing the internship program for your health department, do you feel like there was a learning curve experience when you first started having interns join your organization?
Absolutely. We took resources that we found from other health departments or that we found on Public Health Foundation or NACCHO's website or CDC's guidance. And then to be completely honest and candid, we made it up as we went along and learned from that.
Great. I think that sort of the follow-on to that question was if you had suggestions for kind of getting through the learning curve.
You just got to get out there and do it and try it and be willing to take 2 steps forward and 8 steps back and 4 steps forward and 10 steps back, because the reality is that that's the field of public health anyway. Things are being thrown at us constantly that we're having to step up and learn about. Just the other day, I was reading up on a communicable disease that's reportable in the state of Illinois that I know absolutely nothing about, and I'm the nurse running this health department, and I'm doing a quick little bit of research on, my goodness, how are we going to provide the questionnaire and follow up to this particular patient for a disease that we're not terribly familiar with. I know that many of you on the call can relate to that. Developing your academic health department or your teaching health department is no different than any of the other capacity building tasks that lay ahead of you in local, regional, state, or tribal public health.
Wonderful, thank you. Sort of on the flip side, do you have any suggestions for what academic programs can do to help make this type of relationship happen with the local health department?
I would say invite public health to your table to come to a staff retreat or a meeting. Seek us out perhaps to sit with you and work with you collaboratively to figure out what pieces within your curriculum might lend themselves best or even better to teaching the future workforce about the local public health system. I think we have fantastic regional partnerships here and in Boone County, but I think we have a lot more to learn, and we could make even more of an effort. I think that there are plenty of opportunities in the classroom that would lend themselves well to real world experience. And so approaching your local health department or your state or tribal health department and saying, you know, I have a group of students, or we have this program and we would like to put more of a real world spin on it or more of a real world application. Can you give us some advice or some guidance? And that two-way street, I think, is really, really helpful.
Great. Another kind of, do you have any advice sort of question? Do you have any recommendations for dealing with resistance that you might get from management or staff within your organization to offering internship opportunities? Someone writes in that they are in a large health department that has around 600 employees, and some departments within their organization have phased out internship opportunities because they didn't feel that they had the capacity to participate in those activities. Do you have any suggestions for how to, you know, sort of get over that type of resistance or questioning of the value of the program?
I think what we have learned to be helpful here in Boone County is to include our staff in the process of developing our teaching health department, ask them for feedback on what is working and what is not working. I think that the more that they are exposed to the opportunity to teach enthusiastic, fresh perspective driven student who comes through our doors who is asking questions and wanting to learn more, we have found that over time that has bolstered employee morale and even pride in the day-to-day work that they do. It's kind of that training process of, you know, when you're training for a new job, you observe for a little bit and then you try it yourself under somebody's guidance and then you do it on your own. And then there's that fourth piece that is sometimes missing, I think, in local public health, is then you teaching somebody else to do it, right? And so our staff is constantly being exposed to that opportunity to teach and reteach and teach and reteach their skill set to a student. So allowing staff to be a part of the process and not sort of dictating or managing, this is how it's going to go and this is how we're going to set it up and y'all need to get on board, has been extremely helpful for us here. I think identifying a few champions, if you're at a large health department, I think you said like 600 staff, you may need to have a few champions that are not management staff, maybe some of your frontline staff that have had a really successful experience with an intern to help to champion the program to their coworkers.
Wonderful. And kind of along the same lines, do you have any advice to share on determining capacity, like how many student interns it might be possible for the organization to take on at a time, or even per year? This person writes that they get really frequent requests for student nurses, for example, of all preparations, undergraduate, accelerated, and BSN completion. So struggling a little bit with how to know how many they can handle, I guess.
Sure. So we worked on that for a while and made some mistakes and then learned from it, and then made a few more mistakes and then learned from those. And we have several different tracks I had mentioned in the presentation. We have these half-day clinical rotations for nursing and MD students, and then we have like a semester-long or a summer-long internship process. And we have just learned through trial and error that in a department our size, with the staffing that we have, that we will take usually no more than 3 interns at a time that are here for a semester-long program. And then we will spend 2 to 3 half days a week in addition to that, allowing RN and MD students to rotate through for half-day periods of time. And that is where this 10 Essential Public Health Services scavenger hunt that we built about 1.5 years ago has come in extremely handy, because it takes a little bit of the pressure off of the staff to you know, quote unquote, entertain a student for 4 hours. If they're actually given kind of their homework assignment that's very interactive from the moment that they walk. through the door. So we would have up to 3 interns at any given time here with a designated workspace working on projects assigned a mentor. And then on top of that, we would have 2 to 3 mornings a week where we would bring 1 nursing student or 1 MD student in at a time. Now that's not always foolproof. Sometimes the schedule gets messed up, and at our morning huddle, there's 2 nursing students standing there. We're like, oh no, somehow there was a miscommunication. Well, then we just rework the plan for the day, and we send 1 student out on food inspections. We put 1 student in the clinic, knowing that they're going to walk away with a meaningful experience wherever we put them, because we put the effort in to show them that this is an exciting place to work.
Great, thank you. And we have a very practical question about how do you find your interns? Is it through, like, simply through the partnership agreements that you have with universities, or do you also have job postings, things like that?
So we do a variety of different things. We have students that seek us out because they have credit requirements through their academic institution that they need to fulfill. Our academic partners do a really good job now that they know more about our philosophy, because we've really solidified that and put that information in writing to them. They send students our way if they think it's a good fit. We have the information available on our website. We have also found that word of mouth from a great intern then brings us another great intern, because the student goes back to their cohort and says, gosh, I had this wonderful internship experience. You should consider applying too, given what I know you're interested in, in your program of study. So we've had a variety of different ways in which people have sought us out. On occasion, we have a very specific project where we've got a gap that we need to fill, and we'd like to fill it quickly as far as getting a specific set of work accomplished. And in those cases, we would actually put a job description out there regarding, this is a specific project we need done, and we're looking for an intern to fulfill this. And we anticipate it taking about this many months and about this many hours.
Excellent. Well, I know we're getting close to time, and Bill, I want to turn it back over to you in a second. We do have a number of questions that we didn't get to, so our apologies about that, and hopefully we'll be able to follow up with you all after the webinar. Also, a number of kudos and comments about how organized and structured your internship process is, and how this is something that a lot of programs could do and should do. And several requests for if you're willing to share some of those additional resources you mentioned. So we will follow up about all that, and I will, at the moment, turn it back over to Bill to bring us home.
Terrific, Kathleen. Thank you so much for managing that process. And Amanda, again, our thanks to you for presenting your activities and answering the questions so well. Well, we hope you've all on the call found this afternoon's webinar informative. And please, once again, let me thank our presenters for sharing their time, expertise, and experience with us. This last slide is here to give you an overview of the resources available through the Academic Health Department Learning Community to those interested in exploring the nature of academic and practice partnerships, how to develop new relationships, or how to maintain and improve existing relationships. And in addition to our regular webinars, you may wish to interact with our Ask the AHD Expert column on the Public Health Foundation Pulse blog, and examine our library of Academic Health Department resources and tools on the Public Health Foundation website. And if you don't already receive it, sign up with Kathleen at kamos@phf.org for our newsletter called the Council on Linkages Update. And that brings our webinar to an end for today. So once again, thank you all for attending. Thank you once again to our presenters for a fine presentation, and best of wishes to all of you. Goodbye now.